government step up their response to the COVID-19 pandemic?
There are systems in place to protect us when issues like this occur.
As the economy slows, one food bank prepares to ramp up its services.
The only thing we'd ask is patience, because the lines can get long.
And a call for blood donations as supplies become scarce.
The U.S. Surgeon General has stated we can go out to give blood.
Hello and welcome to Arizona 360. I'm Lorraine Rivera. Thanks for joining us. More cities in Arizona joined the state and federal government this week in declaring emergencies over COVID-19. Most notably, the mayors of Tucson and Phoenix announced restrictions on dine-in restaurants, bars, and gyms.
To unleash the full power of the federal government in this effort today, I am officially declaring a national emergency.
With every declaration come varying stipulations as longtime establishments shuttered their doors.
It's just a big question as to how long this will last.
Schools across the state also canceled class.
I encourage people to go to your neighbors and try to do some kid sharing.
And our nation's borders became more exclusive.
Canada and the United States will temporarily restrict all non-essential travel.
Steps taken in an effort to slow the spread of the novel coronavirus.
We're not guessing. We're being guided by data, facts, and science.
For a better understanding of the government's response so far, we got insight from Dr. Richard Carmona, former U.S. Surgeon General during the Bush administration, who served during the SARS outbreak in 2003. In a public health crisis like this one, who should be calling the shots? I mean, we're hearing things from the state, local, and federal authorities.
I think we all have a role and a responsibility. I think the federal government can set the tone for the United States, but each state is different. How the disease is expressed in each community is different. So we apply the same public health science, but it may be a little different in each community. Whereas hand washing and social distancing is the same in different communities. Where you see clusters of diseases, you might take more aggressive moves more quickly at that point. So there's where you see the differences across the United States.
Here in Tucson, for example, a local emergency was just declared, but last week a state emergency was declared. It seems like there's a lot of finger pointing going on. What should the public make of all this back and forth?
Well, I think the public, what we need to do is to reassure the public that there are systems in place to protect us when issues like this occur. The governor's looking through a different lens, a state of 7 or 8 million people, scattered over hundreds of thousands of miles. The city of Tucson is much smaller, and they're looking at a different microcosm. So it's not one is right and one is wrong, but the governor may pull the trigger a little earlier because if he declares an emergency, it allows him to free up funds to do more. It allows him maybe to move the National Guard someplace to assist. So there are reasons sometimes that happens.
All right, you were Surgeon General during SARS in 2003.
Yes.
What can we take from what we learned then and apply it now? Are there any parallels to draw?
Well, the first parallel is that SARS is a coronavirus, okay? And viruses act similar, except the virus we're dealing with now is a, a mutation. So what that means is the genetic fingerprint changed, and so it expresses itself a little bit differently. So whereas we can say it might act a little like the coronaviruses, since it's new, we don't know exactly what it's going to do, but we do know since people haven't been exposed to it, it is a potential problem because you don't have any immunity. And those people who are immunosuppressed, who have cancer, who have AIDS, who are taking drugs that will suppress their immune system are at higher risk. For most of us, this will be a common cold or maybe a little sicker than a common cold, but you'll probably do okay with it. But the vulnerable populations are the ones that we're most concerned with now.
If you could take something from what you learned then and apply it now, what would it be?
The most important thing, and we learned that in SARS, but we learned it during Katrina, tsunamis, and a whole host of other emergencies, is you have to learn to inform the public and not inflame the public. Make sure that there are good science-based information provided to the public so that they can make good decisions. Make sure that the person speaking is a person of credible authority in the area so that the public feels, okay, this is the right person to be speaking to me. And then make sure that the public understands that in a challenge like this, we will continue to evolve on a daily basis as we get new information about what the virus is doing, how many people are sick, what city is it in now, where is it moving to. And because of that, in public health, we'll take different steps. And it's not that we're changing our mind, it's just that we understand this is an evolving threat.
When the public sees the president, the governor, the mayor on the news, the media, it's wall-to-wall coverage, it's natural for the public to worry and wonder what's happening out there. So what should they make of all the messaging?
Well, I think all of the messaging that I've seen is well meant. The problem is sometimes it's conflicting, and you have one official saying something, another official says something else. Somebody says, let's do 50 feet, let's do 25 feet, let's do spaces of so much. And the public goes, well, which one should I do? When we make those changes, we owe it to the public to have them understand why we're being more restrictive. We're seeing more disease, so we want to separate the space between you and somebody else. We want to decrease the amount of people in an open space, because the more crowded it is, the more likely we'll transmit the virus. So it's not that they're wrong. Well-intentioned people are all talking at different times, and the public is, well, who do I believe? It's up to us to communicate effectively in a health-literate, culturally competent manner, because our communities are so diverse. We have to be able to understand and communicate at their level. This is really complicated science. For the most part, the average person is scared. They're scared of the uncertainty, and sometimes the uncertainty can be more toxic than the disease itself because of the fear and uncertainty.
In your professional opinion, given the risk, given what we know now, is the United States, locally here in Arizona, are we taking the appropriate steps?
We are. I do believe so. We have a system in place called the National Response Framework that we worked on a decade and a half ago, after 9/11 and after Katrina, because we realized then that we have to be able to surge at a moment's notice, that different organizations have to be able to work together, and it's essentially an incident command system like fire and police use today, but ability to use it at a big scale, at a national scale. So we have that here, and we're scaling up now. You hear the questions: how many beds do we have? Do we need to have some pop-up hospitals to take care of people? How do we screen them differently? That's not being reinvented today. All of that is in the playbook as to how we do what we call all hazards. And coronavirus is one of those all hazards, which we put under the umbrella of emerging infections. And we see them all the time. This one happens to be problematic.
Okay, and some promise that better days are ahead.
Yes, of course.
Okay, Dr. Carmona, thank you.
Well, thank you, Lorraine.
As we've mentioned, all of the precautions taken so far, however drastic, are meant to prevent people from being exposed to the coronavirus. Germs can rapidly spread, especially in indoor environments, as we learn from Charles Gerba, an environmental microbiologist with the University of Arizona. Keep this simple for me. What is the coronavirus?
Coronavirus, actually, there are coronaviruses that occur every year. They're part of the common cold viruses. They cause about 5 to 7% of the common colds every year in the United States, but nobody dies from it.
What makes this strand so different than previous years?
Well, I think this current coronavirus is a much higher rate of mortality. Usually with the common cold coronavirus, we have no recorded mortality. It's not as bad as the SARS agent that occurred in 2003, where the mortality rate was 10% among the general population. This new coronavirus is about 3 to 4% mortality, so it's less, but it's spreading much faster. The SARS agent that occurred in 2003 didn't survive well in the environment, thank goodness, so it wasn't as easily transmitted as this new coronavirus.
Some of the practices that many of us are undertaking, reduced work hours, working from home, no more handshaking, no more gatherings of 10 or more. How effective are those measures?
Well, limiting exposure is one of the keys to preventing the movement of this virus from one person to another. For example, let me give you the idea. We've done studies where we put a tracer virus on a push plate to an office building of, say, 100 people. Within 4 hours, it's on 50% of the people's hands and half the surfaces in that facility. It's quite interesting that the coffee break room seems to be the area where people not only exchange germs but also gossip at the same time, because that seems to be the first area contaminated. So separating people at work, not going to work, is a really good idea, because we've seen the viruses spread very rapidly in an office environment today.
Dr. Gerba says the novel coronavirus can survive in the air for several hours and live on surfaces for 2 to 3 days, factors that underscore the need to disinfect surfaces and keep hands sanitized, something his lab focuses on enhancing.
We're working on continuously acting disinfectants, which we would put on a surface, but anytime a virus lands on it, they would start killing it right away. And that's one of the new weapons we feel in germ warfare that would be very useful. So we're rapidly working right now on all kinds of new technologies that could be used to coating surfaces to reduce the spread of viruses like the new coronavirus. And that's one of the things we're really emphasizing here.
How quickly can you take what you're doing in here and apply it out there?
Well, we're hoping the technology is available out there. We're just trying to make sure it works and it works correctly to reduce the spread of the viruses, but still it's going to be months before it's going to be available.
One of the nicknames you have is Dr. Germ, so how disgusting are things like this phone?
Yeah, I get that nickname because we study how germs move in the environment, where's the most contaminated surfaces, and phones are one of the worst. Most people talk dirty without realizing it all the time because they're continually putting bacteria and potentially viruses on the phone surfaces. Studies in hospitals have shown that phones can play a role in the transmitting of certain diseases in hospital and healthcare situations, so we know they're involved. But what you're doing all the time without realizing, you're touching a surface, then touching your phone, so you're moving a microorganism from the surface to your phone. Now, you put your phone in your pocket and you go home, and then you touch the phone again, you take the microorganisms off, and you can bring them to your face or other surfaces in your home environment.
A lot of uncertainty. What can we do to protect ourselves and minimize some of the risk we're passing along to each other?
Well, what we've seen in our studies, hand sanitizers used routinely, disinfecting wipes, and social distancing seem to work the best. In more recent work, in looking at how viruses move in the home, we found that actually bar soap and cloth towels you dry your hands with, face towels basically, can also serve ways of spreading microorganisms in the home. That's one reason you don't see bar soaps in public facilities, because they can get contaminated and one person can pick up a virus to another. We've collected several hundred towels from homes, and actually within a few days you get fecal bacteria usually growing in them because they stay wet, they stay moist. You don't get all the bacteria on your hands when you wash your hands, and they contaminate towels. So what you should do is use separate towels for individuals in the homes and change them every 2 or 3 days, and use liquid soap if you can.
We don't always get sick, so over time do our bodies just adjust to some of these?
Well, you don't get always sick, but you're gambling with germs all the time. You have the right hygiene habits, washing your hands, on a frequent basis, particularly you're out in public, and that staying home when you're ill is things. So you're running a germ gauntlet all the time. And the idea with using hand sanitizer, disinfecting wipes, washing your hands is to keep the odds in your favor and not the germ's favor.
Now, you've been at the U of A for nearly 40 years. You were here for SARS, H1N1, now you're here for Corona. Are we learning something from all these illnesses?
Yeah, I think eventually we're learning something. We've had a series, microorganisms don't give up. I mean, basically we're their food supply, and they can evolve very rapidly. So this is kind of what's been expected. Also, the human population is growing to much larger numbers, so they're more likely for organisms to adapt and spread very rapidly through large populations like we're seeing. So this won't be the last virus that we see, and hopefully we'll be better prepared in the future.
Okay, Dr. Gerba, thank you.
Thank you.
The coronavirus emergency forced organizations everywhere to change how they operate and adopt new safety guidelines. In Tucson, that includes the Community Food Bank of Southern Arizona. It helps about 200,000 people each year, and in the coming weeks, it anticipates that need will grow. Tony Paniagua has more.
Somebody has a copy.
Green beans.
Green beans. Low sodium green beans.
That's fantastic.
Yep.
The food bank is not a fast food restaurant, but it is taking a lesson from the same playbook. Residents who receive food bags or boxes now pick them up via drive-thru. It's a method that went into effect this week to minimize person-to-person contact indoors, where people used to line up.
We're rolling those out across southern Arizona. We serve 5 counties. The reason we're doing the mobile distribution and the drive-thrus is we want to follow the CDC's recommendation, minimize physical contact, optimize social distancing. We've got volunteers to put the food in your car and you're on your way. The only thing we'd ask is patience, because the lines can get long and we want people to be safe and patient with each other.
In addition to the drive-thru system, the food bank canceled Farm to Table. It is one of the group's most important annual fundraising programs that was scheduled for March 28th. The food bank is also postponing a major renovation in its warehouse on Country Club Road. This corner in the facility was slated to be under construction right now, but this too shall wait. The coronavirus is shifting priorities.
We said, hey, maybe we shouldn't be remodeling and ripping up this warehouse right now to put a giant cooler in during a pandemic.
Even though the international pandemic requires adaptability, diligence, and patience, people can't postpone eating, so the food bank's programs remain pivotal. For a Tucson resident who recently lost her job, the emergency food assistance is indispensable.
I'm lucky I have a pretty strong work history. And at first I wasn't too concerned because I have a strong resume. Then everything happened and, people aren't hiring as they were, not in the field that not in the work that I do. It's a little scary, I'm doing the DoorDash thing right now, trying to make ends meet, things like that. So trying to get some kind of income because aside from the food, there's still utilities, there's still gas, there's still insurance for the vehicles, things like that are not going to go away.
Moving forward, the food bank is trying to keep operations as normal as possible considering the circumstances. Staff members are stepping up wherever they can, and the organization put out a call for volunteers.
Have a good day.
An invaluable resource that makes this all possible.
So young people, it's your time. If you're 16 years of age, you're bored at home. You're a Pima college student, you're a U of A student. There's only so much of being at home. We need you. If you're healthy, you're young, you're strong, Community Food Bank is here.
I find this very enriching. I'm doing my part. That's how I feel. That with my financial contributions and the skill set that I have prior to coming in here, this is something that I like to do.
I think it's a really great help for the community. I think a lot of people, there's a lot of need. A lot of people need it, especially now with everything that's going on. Things are getting scarce and not enough groceries in the stores and stuff like that. So I think it's a really needed service for our community.
Have a good day now.
The food bank is also asking for hands-free donations. Instead of bringing food to the warehouse, staff prefer people go online to communityfoodbank.org and make a monetary donation from home. As businesses and organizations either close their doors or scale back events, fewer blood drives are taking place. Every 2 seconds, someone in the U.S. needs a blood product. And as the nation's supply faces a severe shortage, the American Red Cross is calling on all eligible donors. We learn more about the situation from Southern Arizona Executive Director Courtney Sloniker and Regional Executive for Blood, Dan Cavanaugh. We should note, Cavanaugh also serves on AZPM's Community Advisory Board.
Right now, as of March 18th, across the country, we've had 4,000 blood drives cancel for different reasons, resulting in about 100,000 fewer blood units collected. To put that in perspective locally, here in Southern Arizona, we've had over 52 blood drives cancel, resulting in about 1,300 fewer blood units collected, and we're expecting that number to only increase.
Dan, how does this translate to, who does this impact? The average person who relies on these regular transfusions, for example?
We provide 40% of all blood in the nation, and we're the #1 generator of blood in this area. So really anyone who ends up with a need, quite often that isn't anything planned. Something unfortunate happens, you end up in the hospital, somebody needs blood, and you always assume it's there. And it's because, in part, the Red Cross has been so successful. And that's why when there's a shortage here, it becomes important throughout the region.
Where's the balance in all this? Because we're not supposed to be going out, we're supposed to be far apart from each other, and now you want blood. So how do we make all this work?
So we know that we absolutely have to continue our blood collections to ensure we save people's lives. The U.S. Surgeon General has stated we can go out to give blood. There are certain functions here that to support our community that are absolutely required. Your hospitals, your grocery stores, your pharmacies, and your blood drives. Without the blood drives, we cannot deliver on our life-saving mission and save lives with the blood products. So it's one of the big asks that we're asking the public to come out as one of those basic necessities for our community's health.
But you are seeing organizations cancel blood drives because the people aren't working anymore. So how do we do this?
So that is a great question. We have a lot of organizations that step up and host blood drives all throughout the year. We are so grateful that they do that. But yeah, they're going to, their teams are working remotely. People aren't coming into the office, but we're asking, please still host your blood drive. We are seeing donors still coming out to donate, but we need the space to host the blood drives.
Now, Dan, big picture wise, this has happened before where we've had these shortages. So how have you addressed the need in the past? What can you take from those experiences and apply them now?
Most folks would rather, as the old saying goes, light a candle than curse the darkness. Somebody was saying, I don't see anything good. I think a lot of people say, here's my chance to make a difference. I can go out and be a hero. I can help save somebody's life. I can help someone who's facing a cancer challenge. I can go home and feel good about myself tonight when I see the issues facing America and the role that I'm playing.
This is tricky though, because it is flu season, a lot of us not feeling like we're capable of doing this. So what sorts of things should we ask ourselves before finding a donation site?
So we're asking all healthy individuals to come out and donate. If you have questions about the donation process, please call us. It's 1-800-RED CROSS. If you're unsure about donating, if you have questions in relation to coronavirus, give us a call. We'd love to talk to you about it, but we're asking all healthy individuals. We want to protect you as a donor, and we want to protect the client that's going to need that product.
If you've been inside one of your mobile units, it's kind of tight in space in there, and if you've been down to one of your facilities, I mean, you're pretty close to people. So how's this all going to work?
So the Red Cross has implemented additional safety protocols in an abundance of caution in addition to the safety protocols we already have in place for collecting blood. We want the public to know it is a safe process. The protocols we've implemented in response to the coronavirus, we do pre-screening temperature checks of anyone that comes to a blood drive. That includes our staff members, our volunteers, and the donors that are coming in to donate. Everyone gets a temperature check. We've enhanced our disinfecting procedures, and where possible, we have practiced the social distancing measures, spacing the donation beds further apart. Our staff are practicing social distancing measures as well, but we do have those safety protocols in place already and have already enhanced them.
You can go to redcrossblood.org. You can type in your area code, and they'll give you the nearest place and time where they've got a nearby blood drive, or as Courtney said, you can call in and make an appointment.
All right, Dan and Courtney, my thanks to both of you.
Thank you so much.
Concerns about the COVID-19 pandemic lingered over the legislature this week, where state lawmakers are taking their own precautions. As for what that looks like, we got information via Skype from Luigi Del Puerto, editor of the Arizona Capital Times in Phoenix. So traditionally, the state legislature starts to wrap up the session. Any indication that's likely to happen here in the next couple weeks or so?
What's going to happen is they're going to try and pass what they refer to as a skinny budget. Effectively, it's a budget that's based on the previous fiscal year, and they're going to adjust it for inflation. They're going to add a couple spending items that they've all agreed upon. And I think the plan, or what we're hearing, the plan is to recess, to suspend the session in the meantime. And then they're going to come back in a couple weeks. Now, when exactly, we don't know.
There are some lawmakers who are asking for emergency bills to be passed. Any specifics about what they're asking for in these bills?
Well, the Democrats, for example, are pushing for legislation that they believe will help workers at this time. They want to ensure, for example, that utilities are not turned off. They want to ensure that benefits, workers get the unemployment benefits. The Democrats have urged the legislature to consider these things in the state budget, the skinny budget that they're supposed to tackle today. The likelihood of those Democratic demands actually getting passed at this point are minimal.
Where does education fit into all this? Because there's some question about the instructional hours that have been met thus far this school year.
The Senator Sylvia Allen and Representative Michelle Udall have unveiled the plan yesterday, and the plan effectively provides certainty to the schools at a time that they're closed down, and it outlines what will happen if the schools reopen, say, by the end of the month, and what happens if the schools don't reopen by the end of the month.
What's the climate like, given that the CDC is recommending that groups of 50 or more don't gather? There are open meeting laws that have to be followed.
It's very stressful. As you know, we've never seen anything quite like this. We know that there are at least 4 legislators right now that have adopted what you call social distancing. So the Senate, for example, as of yesterday, does not have a functioning Republican majority because they're missing 2 people. In the House, Representative Steve Pierce, another Republican, also said that he's going to start social distancing. He might show up today to vote for the skinny budget, or he might not be in today. However, the House has a contingency already adopted for that. The House yesterday passed a rule to allow for remote voting. That's something that technology allows for it, but they've never contemplated that until today, or until this week, or this time.
Okay. In the midst of all this, on Tuesday, there was an election in the state of Arizona. Joe Biden, of course, as we know now, the numbers are in, has defeated Bernie Sanders. How does this set the stage as we inch closer toward November?
Well, we know, for example, that Maricopa County Recorder Adrian Fontes tried to mail all the ballots to everybody, effectively institute a countywide mail-in ballot program, and his plan was thwarted. People said that he didn't have the legal authority to do something as dramatic as what he was trying to do. And this week, Secretary of the State, Katie Hobbs, asked the legislature to pass a law to allow for a statewide mail-in ballot. It is something that Democrats had contemplated in the past. It seemed like a pretty far-fetched scenario, just 2 weeks ago or 3 weeks ago. And, that idea is now before the state legislature. What we're hearing from the from the legislative leaders is that they're not quite immediately shutting the idea down. It really depends on what happens in the next couple weeks. Are we going to see this self-isolation that we're all in continue for the next couple months? Is coronavirus going to go away when summer rolls around? There's a lot of unknowns.
For more about the coronavirus, you can follow all of Arizona Public Media's coverage and get information about resources at azpm.org. That's all for now. Thanks for joining us. To get in touch, visit us on social media or send an email to arizona360@azpm.org and let us know what you think. We'll see you next week.